I'm Dr. Ruth Roberts, and I'm sitting here with Kelly Cogen, my very first international graduate of the Holistic Pet Health Coach Certification Program. And I wanted to ask you about your general experience with the program, what you thought of the course.
Okay, it was more than I expected, to be honest, because we have the weekly calls, we have the information, we have the build-up in the course. So after all of this time, you really have a whole package of information that you can use to support pets. So it's really amazing. And what was really interesting for me is that it doesn't stop when the course ended. We can also rely on your support when you have questions. So that's really amazing.
That's awesome. And so that's why I wanted to continue doing the coaching calls weekly, that as you continued to see cases, you'd have more support. And during the course, you had access to Mint with Rhiannon. How was that experience working with your mentor?
Yeah, that was really nice. Rhiannon is a fantastic woman, of course, so that was really nice. I really felt comfortable with her. But it was also good to know that there is somebody who took the course in the past and who knows what is going on and how you need to do the assignments. When something isn't clear, we just could ask her. So that's really nice that there was another backup system.
That's awesome. And with the technology part of it, with where the course was housed and submitting homework, was that fairly easy and intuitive to work through, or?
Yeah, at the beginning we had some issues, but that really was sorted out really quickly. So it was really easy to know where to put all the assignments and where to find the information. So yeah.
Great. So if somebody were to ask you about the course, what would you tell them if they were interested in taking it?
Yeah, I would really recommend it because I took a lot of classes in the past and none of them was like this. Because there's the Western part that you talked about, then we have the holistic part, we have the nutritional part, we have the backup system, we have the mentorship, we have all the right sources. I would really recommend them.
Wow, great. And it's not an inexpensive investment. Do you feel like the investment you made, you've been repaid?
Yes, absolutely. Yeah, because the course of its own was a lot, but then the backup afterwards, that's just something you can't pay for. So I'm really glad I did it.
Wonderful. So you were doing a lot of work with dogs before you even started the course. So how did you get started in this crazy business?
I started, I think, 3 years ago, but I started studying 12 years ago. I took my time to get the information I needed and to feel trusted enough to help people and dogs, of course. And then I came across your course, and then something that really added up for me. So I feel much more secure now because I know there's always somebody I can ask questions to when I'm uncertain about something.
Wow. So when you started studying the courses that you've done already, can you tell me some of the courses you've taken prior to this one?
Yes, I took a graduate in Belgium. It's called Agro and Biotechnology. It's an animal course of 3 years where you learn Western medicine to support dogs and cats. And then I started studying the more holistic pet. So I took a lot of herbal courses, and then I went really deep in nutrition. I took, I think, 10 courses of nutrition. Yeah, I've done a lot of things.
You have done, and you had been working with clients for over 3 years now.
Yes.
And that you've been getting fantastic results already. So can you speak about some of your cases that you've had the most pleasure working with?
Yeah, of course, it's always a pleasure to help pets, but when I must choose, I think the pets that have allergies or have IBD or chronic GI issues, because with a regular vet, there's not much more that they can do. So then we can help them to get them more in the path of health.
And so with the pets, then you'll work with their nutrition.
Yes.
And then add in herbal therapies.
Yeah, and supplements and things like that. It's really a whole package when they come to me.
That's amazing. And so when you work with people, then you're working with them remotely generally, is that right?
Yes.
On Zoom? Yeah.
Yes, I have an online practice.
Wow, that's awesome. So how many clients are you supporting currently?
Oh, it are a lot. I have a waiting list at the moment.
Wow.
I don't know for sure, but I think at this month I'm supporting like 50 clients.
That is awesome.
Yeah.
Have you ever thought of doing like a group coaching program?
I'm a bit too shy for that at the moment, but I think it will come. Yeah.
Yeah, if you're already booked, your services are well needed. Yeah. Wow, that's amazing. And that you have so many clients you're working for
Yeah.
speaks to the results that you're getting already.
Yeah, I never thought this would happen to me. So I'm really happy that I can, it's my living. It's what I do the whole day. There's nothing left for me than working for pets.
Ah, that
Yeah.
is amazing. And you've got 5 dogs here, and
Yeah.
then you've got your 2 kitties.
Yes.
So, and you've got quite the crew. You've got a couple of English setters that
Yeah.
you've rescued, and then your oldest here.
Yeah. No.
So tell us a little bit about your own pups.
Yeah, sitting here, he's my oldest. He's almost 14.
Wow.
And a year ago, he started having liver issues. He has a liver cancer. And at the moment we got that news, we had the option to operate him or do nothing, like they say, but we supported him with herbs and with his nutrition. And we're a year further and he's still doing very great. So
That
it's
is
very
amazing.
amazing. We never thought that we would still have him. We're really happy. And then our other dogs, I don't know. Yeah, we have Lizzie. She's an English Spaniel. We rescued her 6 years ago. And 3 years ago, she got cancer. So that was another big thing. But yeah, we also support her. She gets a really, how do I have to say it? a really nutrition for her disease and her state of health. She gets all the support she needs.
Wow.
And then we adopted Siep a half year ago. He's our last one. And he was on kibble when he came to us. So we had to really transition him. And they told us he didn't like his food, and now he's the one who's asking the most for food. He's really barking 5 minutes to get his food. So he really loves fresh food.
Yeah.
And then we have Lena. She's 10 years old. She's also doing really good, and she looks like a 5-year-old or something like that. She's really good health. And then we have Fans. He's also a Springer Spaniel, and he's 3 years now. And he's also eating fresh food and doing very well.
Looks wonderful.
A lot of them.
Yeah. So with Lily, what kind of cancer did she have? Does she have? Or did she have?
She did mast cell.
So she is 3 years post-diagnosis with
Yeah.
mast cell tumor, which is in the United States was a miracle. So kudos to you for
Yeah.
figuring everything out.
Yeah, I was really nervous. It was an awful news we got because she was really young at that moment, and I really thought we were going to lose her.
It's astonishing.
Oh,
Wow. That really is a remarkable achievement,
Yeah.
both for her and for you, to figure out how to make that happen, because it's a very difficult cancer to deal with.
Thank you.
Congratulations.